Welcome to the Volusia County Schools Social Emotional Wellness Overview. Volusia County Schools is leading the way, bringing more mental health and substance abuse services in to meet the needs of all of its students. In 2018, the state of Florida passed Senate Bill 7026, which stated that each school district would increase security measures, add law enforcement and school guardians at each school, and provide mental health services in addition to already established programs. Volusia County Schools modeled the Mental Health Response Plan on the CDC's Whole School, Whole Community, Whole Child framework, where schools, health agencies, parents, and communities share a common goal of supporting the health and academic achievements of students. As part of the Volusia County Schools Mental Health Plan, the multiple mental health teams are strategically located to quickly respond to district-wide needs and consist of licensed school psychologists, social workers, and mental health clinicians. Research suggests that students who receive social, emotional, and mental health support achieve academically as well as emotionally. School climate, classroom behavior, on-task learning, and student sense of connectedness and well-being all improve as well. Mental health is not simply the absence of mental illness, but also encompasses social, emotional, and behavioral health and the ability to cope with life's changes. Left unmet, mental health problems are linked to costly negative outcomes, such as academic and behavior problems, dropping out, and delinquency. 1 in 5 children and adolescents will have a serious mental health concern at some point while they are in school. Evidence supports the idea that children are more likely to access mental health services provided in school, but significant barriers prevent many students from receiving such support. Providing a continuum of school mental health services is critical to effectively addressing the breadth of students' needs. Comprehensive mental health services are most effective when provided through a multi-tiered system of supports, or MTSS. MTSS encompasses the continuum of need, enabling schools to promote mental wellness for all students, identify and address problems before they escalate or become chronic, and provide increasingly intensive data-driven services for individual students as needed. All VCS employees are vital to the success of these initiatives through their willingness to help students in need find the appropriate help and resources. In the event that a student has a social, emotional, mental health concern, a counselor or administrator will be able to initiate a Handle with Care notification through the Student Information Success platform in Focus. When completed, a Handle with Care icon, which consists of a circle with an exclamation point in the center, will appear next to the student's name. This icon should not be interpreted as a negative icon. It is meant to help teachers to quickly identify any student who needs additional understanding and kindness. It is also designed to encourage you to be vigilant and be aware of any changes you may see in a student with a Handle with Care and alert the school counselor or administrator if you feel additional support is needed for a student. A Handle with Care alert is tailored to reflect the needs and issues affecting students throughout Volusia County Schools. Some reasons a Handle with Care may be triggered are exposure to a traumatic event, involvement in an incident of bullying and/or harassment, have a reentry plan, have had a mental health assessment, or need additional supports for various reasons. On a monthly basis, the school counselor and administration will verify the Handle with Care icons and determine if the icon can be removed or if the student still needs additional supports. At times, a student may write, draw, or make verbal statements that are concerning and potentially may indicate a student is in crisis. Important signs that a student may be in crisis are drop in grades, change in behavior, altered mood, giving away possessions, expressing that they feel hopeless, feeling trapped, seeking revenge, having rage, or engaging in risk-taking activities seemingly without thinking. When you're talking to a student who may be in crisis, you should take the following steps. Step 1, look. Assess the surroundings and the student's needs. Maintain privacy. Who is around? Ensure the student feels safe to discuss his or her concerns. Safety. Ask the student, are you safe? Does the student need medical attention? Are you personally safe? Behavior. How is the student behaving? Step 2. Listen non-judgmentally. Stay calm. Engage the student in an open conversation. Empathize with how the student is feeling about his or her beliefs and/or experiences. And avoid criticizing, blaming, or using sarcasm. Step 3. Observe. Consider the risk factors. They could be physical, such as a pounding heart, blushing, shortness or fast breathing, dizziness, headache, stomach pains, muscle aches, restless or an inability to relax, unkempt, change in hygiene, bloodshot or glassy eyes. Could be behavioral, witnessing crying spells, withdrawing from others, loss of motivation, avoidance or phobic behaviors, showing distress, talking rapidly, obsessive or compulsive behaviors, change in energy levels, seemingly disinterested in personal appearance. Could be thoughts, frequent self-criticism, pessimism, difficulty making decisions, difficulty concentrating, having rigid thinking, believing others see them negatively, delusions, hallucinations, or thoughts of death or suicide. And lastly, could also be emotional, depressed, hopeless, helpless, feeling excessive anxiety, excessive irritability or anger, oversensitivity, low self-esteem, lack of inhibitions, or lack of emotions. Step 4. Support. Give reassurance. Contact additional support as soon as possible. Notify your administrators, school counselors, and/or school nurse. And keep that student with you until you connect them with the appropriate school staff. If the student expresses a threat to self or others, treat it as an emergency and take immediate action to keep the student safe. Remain calm and attentive. Acknowledge and validate the student's feelings of distress and express empathy. Listen without judgment and thank the student for trusting you with the information. You will also want to inform the student that in order to keep them safe, you will need additional support from the school counselor and administrator. Be sure to know your school's procedure. Immediately contact the counselor and administrator. Emailing someone or sending the student on a pass is not enough. Stay with the student until you are able to connect them to a school counselor or administrator. It is important not to leave the student with someone else. Another person does not have the information that the student has expressed to you, plus it may increase the student's anxiety. Remember, the student has entrusted you with the information that will be critical to pass on to the counselor. The counselor will assess the student's needs and begin the threat assessment. A threat assessment team includes school counselors, school administration, law enforcement, and instructional staff. The threat assessment teams will identify members of the school community to whom threatening behavior should be reported and provide guidance to students, faculty, and staff regarding recognition of threatening or aberrant behavior that may represent a threat to the community, school, or self. The goal of the threat assessment process is to keep schools safe and to help students in crisis overcome the underlying sources of their anger, hopelessness, or despair, and to assess them to determine the most appropriate level of response. Effective threat assessment procedures provide school professionals with useful information about a student's risks and personal resources. Once a preliminary determination has been made that a student poses a threat of violence or physical harm to himself, herself, or others, a threat assessment team will immediately report its determination to the superintendent of his or her designee. The school will immediately attempt to notify the student's parent or legal guardian. Nothing will preclude the school district personnel from acting immediately to address an imminent threat. If an immediate mental health or substance abuse crisis is suspected, school personnel will follow the procedures and notify the mental health crisis response team and/or the Office of Safety and Security. The mental health crisis response teams and the safety and security staff are trained in crisis intervention, in emergency intervention and assessment, and are able to refer the student for appropriate services. In extreme circumstances, the team or officer may initiate a Baker Act. The threat targeted school violence brings unique challenges to all members of the impacted school as well as to the school district. Central among these challenges is the need to assess the level of threat, ensure that steps are taken to address the safety of students and faculty, effectively communicate and collaborate with parents, media, law enforcement, and within school district departments, and devise a plan for re-entry. Using the threat assessment team, procedures are developed to ensure a seamless process when addressing threats towards self, others, or school board employees. When a student returns from a Baker Act, the Department of Juvenile Justice, a suspension of 10 days or more, or returns to school following a threat to someone else, a re-entry meeting should occur within 3 days of that student returning. The purpose of the re-entry meeting is to develop a student-specific plan that includes the following. Student support. Support the student's ability to be successful in school when returning from an extended leave. Academic, behavioral, and emotional support are included. Student safety. Provide safety supports for the student to address issues related to safety and security and mental wellness. And lastly, campus security. Ensuring the safety of your campus and appropriate staff are aware of possible safety concerns. One of the best protective factors for a student is to feel connected to at least one adult. At any time, you may be that one adult. A former educator, Rita Pearson, said recently in a TED Talk, "Every child deserves a champion, an adult who will never give up on them, who understands the power of connection and insists that they become the best that they can possibly be." Thank you for being that champion and ensuring that our students' mental wellness is a priority.